Okay, so we have here the lab activity for the blood smear preparation. So we have here the different method for the blood smear. So you could have here your wedge. Your manual wedge method is made up of two slides. One is the spreader slide. So ginagamit na bang spread is your spreader slide. Another one, ang nilalagyan natin ng film or blood. So that's your film slide. Okay, that's for the wedge. Another method here, we have your Airlix. Airlix is dalawang cover slips. Becom, on the other hand, is made up of one slide and one cover slip. Okay, then we have here the sources of the blood that we can use here for making our blood smear. So the first one, we have your anticoagulated blood. So the blood here is being collected from your EDTA. So ideally, dapat you should make your blood film here within 4 hours of collection process when blood is being collected in the EDTA. So I mean to say, within 4 hours, dapat you're able to make your film already. Because more than that, it would result already here to the alteration in the morphology of your blood cells. And pag nagkaroon ng alteration sa morphology ng blood cells natin, that could be mistaken as your abnormal cells. Could be mistaken as your mga leukemic cells and any others. Baka i-report niya ay mga abnormal cells. So, abnormal cells related to different blood disorders. So, we don't want that one to happen. So, that's why you need to, ideally, blood collected from the ETA should be prepared here for the blood film or blood smear preparation within 4 hours. Okay, another one, you could also have here your anticoagulant-free blood. Anticoagulant-free blood is the blood that's being collected from your skin puncture. So, wala siyang anticoagulant that's being directed from or directly from the skin puncture. You try to touch, pag na-prick tayo sa skin ng patient, ita-touch natin sa slide, and then you make immediately the smear. Or pwede din, when you're collecting the blood with your capillary tube, so you could put it one in your slide to become here your anticoagulant-free blood. Ideally, between the two, mas okay ang anticoagulant-free blood because this one is subject to less distortion, subject to less interferences or contamination. Okay, procedure here for the manual wedge method with your spreader slide and your film slide. Okay, procedure for that. Okay, so transfer a drop of the blood, okay, from your EDTA. So, advantages and disadvantages. Okay, pag nasa EDTA siya, so pwede tayo makagawa ng several film, even later on. Unlike dito, since prick natin ang finger ng patient, so kailangan natin agad makagawa ng blood film. Or they would just have your limited lang din ang magagawa natin ng mga slides or smear out of that one. Not unless gusto mo na tusukan ng patient natin. Okay, procedure for that, transfer here, drop of the blood from your EDTA with your capillary tube. Okay, so capillary tube, kuha ka ng blood and put this one here at the other one end of the slide. Approximately, that's 2 to 3 millimeter. So, make sure na medyo, okay, so ganun kalaki ang blood natin. Then, with your spreader slide, okay, try to pick up the entire blood, okay, with your spreader slide. So, that would allow here the entire drop of the blood here to, okay, to be picked up here, occupying the entire edge of your spreader slide. Okay, then, maintaining that one, okay, try to make a film here, and it should have at least, okay, 30 to 45 degree angle. So, parang, ulit, paano tayo maghawak ng film natin? So, dapat ganyan, di ba? Okay, so, itong film natin, itong slide natin, so, pag ganun dapat. Hindi pwedeng pag ganun, ha? Okay. I don't recommend that kind of technique. Okay, then, after that one, so, pag nag-spread tayo, anyway, ideally, you should maintain here 30 to 45 degree angle, or some reference, that's 33 to 45 angle. But you still need to adjust for your angle here. Pwede mo siya increase mo ang angle or babaan ang angle depending on the drop of the blood. And depending din kung sa dami ng RBC ni patient. Like anemic ang patient, so dapat try to increase the angle here. Kung sobrang lapot ng blood, i-decrease natin ang angle natin. Okay, then try to air dry. Okay, so air dry, just let it dry. So, do not blow your slide. Okay, because of course, if you try to blow that one, it might add some, contaminants to your blood smear. Okay, then we have your necessary adjustments as to the angle here of the spread. So, pag too large drop or even too concentrated na blood, hemoconcentrated, sobrang lapot niya. So, we need to increase the angle. Ay, mali pala. Okay, too large drop of the blood here. So, dapat we need to decrease the angle para hindi siya, pag binabaan kasi natin ang angle natin, for example, ito. Okay, so, pag ganan, kung babaan mo kasi siya, pag nag-spread ka, okay, so, medyo mahaba and at the same time, pag mababa ang angle natin, mahaba ang smear natin, at the same time, hindi ganun siya ka-thick. So, yan ay pag sobrang laki ng drop ng blood natin, or sobrang lapot ng blood ni patient. Pero pag konti ang drop ng blood natin na nilagay sa slide, or let's say anemic ang patient natin, so dapat we try to increase the angle. So pag in-increase natin yung angle, what we produce here would be short and thicker na film para since na sobrang labnaw ng blood ng patient kasi anemic ang patient natin. Okay, so therefore you need to increase the angle here as a compensation for the decrease na RBC. Kasi pag binabaan mo pa ang angle mo dito, ano mangyayari? Sobrang thin lalo ng film na magagawa natin. And pag sobrang thin ng film natin, if you try to examine that one under the microscope, wala ka masyado makikitang mga blood cells. Okay, we have here the characteristics of your good smear. So you should have here gradual transition from thick to thin. Should have here the feathery edge, thumb shape, walang mga scratches, walang holes. Okay, and if you try to hold it up against the light, you're able to see here the rainbow on that. Okay, so then dapat it should occupy here 3/4 of the entire film. That's ideal na sample for that. Okay, so you need to have here the feathery edge because when we are trying to examine here the smear under the microscope for your differential count, okay, for the morphology identification, so we tend to examine on the thin area that's in the feathery edge. Because andun ang mga cells natin wherein they are not overlapping, that would allows you then to examine individual morphology of the blood cells. Kasi pag hindi ganun na gradual transition, okay, pangit ang smear mo, mahirapan ka mag-identify ng mga cells natin. Okay, so that's it for the blood smear preparation.